providing privacy and doing hand hygiene. Hello, my name is Elena. I'll be a nurse today. How are you doing? Patient states they are fine. Okay, so today we're going to be going over your lung sounds. So I'm going to be inspecting, palpating, and auscultating. So auscultating, I'm just going to be listening to some lung sounds. Inspecting, I'm just going to look over everything. And then palpating, so I'll just be touching your neck for your pulse on your neck, for your carotid pulse, and then your radial pulse, which is on your wrist. Is that okay? Patient states that it's fine. Okay, so this checkup today will be about 3 to 5 minutes. It shouldn't take that long, just to make sure everything is normal. So I just want to start off with a couple of questions. Do you have any pains or allergies? The patient state they have no pains or allergies. Okay. Can you state your correct name and date of birth? And as I'm looking at the patient's armband, they state the correct name and date of birth. Okay, so what I'm going to start off with is the carotid pulse. So I'm just going to palpate on your neck. Is that fine? The patient state that it is fine. I'm just going to palpate using 2 fingers. Don't use the thumb because you have a pulse in your thumb. Okay, and the other side. Okay, so when I check for the carotid pulse, so when I check for the carotid pulse, the skin tone is even, and the carotid pulsation is visible bilaterally. They have a regular rate, +2 bilaterally. Okay, and now we're just going to check for the JVD in your neck. So I'm just going to have you lay back in a 45-degree angle. So the patient does that. And then I'm just going to inspect, so turn your head to the side. And then I'm just going to check the JVD on this side, and there's no JVD at this time. So I'm just check the other side, and then no JVD. All right, and you can sit back up. Okay, so now I'm going to auscultate, so I'm just going to listen to some lung sounds. So just breathe normal for me. So I would do this on bare skin. Okay, so I will look for the angle of Lewis. So that's in the middle. And then I'm going to start with the diaphragm first. And then go to the side. So the right sternum border, second intercostal is the aortic. Then we move over to the left sternum border, second intercostal pulmonary valve. Then move down to the Erb's point, and that is the third intercostal, S1 and S2. Okay, tricuspid valve, that's at the fourth intercostal, the lower left sternum border. Okay, and then I'm going to move to the left fifth intercostal space, which is the medial to the mid-clavicular line. Okay, good. So S1 and S2 is present. S1 is louder at the apex. S2 is louder at the base, and they heard equally at Erb's point. And I don't hear any heart murmurs. Okay, so we're just going to do it one more time, but this time we're going to use the bell, the smaller side of the stethoscope. And again, I'm going to do this on bare skin. So look for the angle of Lewis, and then go over. So just breathe normal for me. So the right sternum border, aortic valve. And then move over to the left sternum border, pulmonary valve. I'm sorry, both is at second intercostal. And then down to the third intercostal, which is the Erb's point for S1 and S2. And then move down to the lower left sternum border, which is the tricuspid for the fourth intercostal. And then the left sternum border, the left side for the fifth intercostal, which is the medial to mid-clavicular line. Okay, and good. So S1 and S2 is again present. S1 is louder at the apex. S2 is louder at the base, and they hurt equally at Erb's point. And I don't hear any heart murmurs. Okay, for the last part, I'm just going to palpate your radial pulse is on your wrist, and then we're all done. Okay, so just sit tight for me. I'm going to use 2 fingers, can't use the thumb because the thumb has a pulse. Okay, and I would do this for 60 seconds on each side, and then the other arm. Okay, the pulse is regular and the skin tone is even. All right, thank you so much for everything. Just want to reassess, do you have any pain or anything? And the patient states they don't have any pain. Okay, do you need anything else? You need water or anything? The patient state they are fine. So at this point, I will lower the bed and bring up the bed rails and bring the call light next to the patient. Just press the button on the call light if you need anything, and I'll be in the next room over. And thank you for coming. And hand hygiene.